This week on Health Across the Islands, Venezuela confirms hantavirus deaths as health officials intensify surveillance. Venezuela reports increase in vaccine-preventable diseases. Hemorrhagic dengue raises alarm in Cuba. UK healthcare worker monitored following Ebola exposure. Jamaica strengthens produce monitoring amid US Cyclospora outbreak. All this and more when we return in this week's episode of Health Across the Islands. Thank you for making it Health Across the Islands, your Caribbean weekly health news briefing. I'm your host, Natasha Robinson. Venezuela has confirmed 3 deaths from hantavirus in the eastern state of Anzoátegui, marking one of the country's most significant reports of the rodent-borne disease in recent years. The victims were members of the same family living together in the rural municipality of Miranda, according to the health authorities. The confirmation follows several days of uncertainty after reports emerged of a mysterious illness causing multiple deaths. Laboratory testing has now identified hantavirus pulmonary syndrome, or HPS, as the cause of death in the 3 family members. Meanwhile, health officials are also investigating the deaths of 2 healthcare workers in the western state of Barinas. Authorities say those deaths remain under investigation, and at this time there is no evidence that they were caused by hantavirus or that they were connected to the Anzoátegui cases. Hantavirus are carried primarily by wild rodents and are transmitted to humans when people inhale tiny virus-containing particles from rodent urine, droppings, or saliva, particularly when cleaning enclosed spaces such as barns, sheds, storage rooms, or abandoned buildings. Infection can also occur after direct contact with rodents or less commonly through rodent bites. Human-to-human transmission is considered extremely rare and has not been documented in Venezuela, according to the country's Ministry of Health. Early symptoms often resemble influenza, beginning with fever, severe muscle aches, fatigue, headaches, nausea, vomiting, and abdominal pain. Within a few days, some patients develop coughing and rapidly worsening shortness of breath as fluid accumulates in the lungs. Without prompt intensive medical care, the disease can become life-threatening. In response, Venezuelan authorities have deployed epidemiology, environmental health, and vector control teams to the affected communities. Officials say no additional suspected cases have been identified in Anzoátegui since the initial cluster, but surveillance has strengthened while investigations continue. Public health officials are advising residents, particularly those in rural and agricultural areas, to reduce exposure to rodents by sealing homes, storing food securely, eliminate rodent nesting sites, and using appropriate protective measures when cleaning areas contaminated by rodent droppings. Anyone experiencing flu-like symptoms after potential rodent exposure is urged to seek medical care immediately. And still in Venezuela, health experts are reporting higher than expected numbers of hepatitis B, diphtheria, and pertussis. These illnesses are largely preventable through routine vaccination, yet declining immunization coverage in some areas have allowed outbreaks to occur. Health professionals are encouraging people to review their vaccination records and ensure that they are up to date with the recommended immunizations, including tetanus boosters when appropriate. Vaccination remains one of the most effective public health measures ever developed, protecting not only individuals but also vulnerable members of the community who cannot be vaccinated because of age or medical conditions. Health officials in Cuba are responding to an increase in dengue fever cases, including reports of dengue hemorrhagic fever in the municipality of Ranchuelo. Dengue is transmitted by the Aedes aegypti mosquito, which is found throughout the Caribbean. While many infections cause mild illness, some people develop severe dengue, which can lead to internal bleeding, shock, and even death if not treated promptly. Warning signs include severe abdominal pain, persistent vomiting, bleeding from the gums or nose, blood in vomit or stool, extreme weakness, and difficulty breathing. Anyone experiencing these symptoms should seek immediate medical care. Communities are encouraged to eliminate standing water around homes, cover water storage containers, use insect repellents, Install window screens where possible and wear clothing that reduces mosquito bites. With many Caribbean countries also experiencing favorable conditions for mosquito breeding, this serves as an important reminder that dengue prevention starts at home. A healthcare worker from the United Kingdom is being monitored after potential exposure to the Ebola virus while working in the Democratic Republic of the Congo. The individual was safely transported to the UK under strict infection prevention protocols and is receiving specialized monitoring. Health authorities emphasize that this is just a precautionary measure. The healthcare worker is not known to be ill and there is currently no evidence of any wider public health risk. Ebola spread through direct contact with the bodily fluids of someone who is sick with the disease. It is not spread through the air like influenza or COVID-19. This incident highlights the importance of protecting frontline medical workers and maintaining strong international systems for responding to emerging infectious diseases. Jamaica is strengthening surveillance of imported fresh produce following a Cyclospora outbreak linked to fresh food products in the United States. Cyclospora is a microscopic parasite that causes prolonged diarrhea, stomach cramps, nausea, fatigue, and weight loss. Infection usually occurs after eating contaminated fresh fruits or vegetables. Although no outbreak has been reported in Jamaica, authorities are increasing inspections and monitoring imported produce as a preventative measure. This especially after a case was identified in the Cayman Islands and also one in Puerto Rico. Consumers can also reduce their risk by thoroughly washing fresh fruits and vegetables before eating them, practicing good hand hygiene, and following food safety recommendations issued by local health authorities. This proactive response demonstrates the importance of a strong food safety system in protecting public health. Those are your top Caribbean health stories for this week. I'm your host. Thank you for watching. Until next time, stay informed, stay healthy, and we'll see you in the next update.